Listen, we are all familiar here in New Jersey with the opioid crisis, and when you look at the impact that it's had across our country, millions of people, unfortunately, have fallen prey to addiction. What we don't hear enough about is what's being done to prevent the need for opioid use and the risk of abuse that comes along with it. 50 million surgical procedures in the United States every year, and 9 out of 10 patients are given opioids for their pain. Is there hope and help? Possibly. My guest on the Jersey Central Newsmaker Hotline is the Associate Professor and Associate Director of Clinical Research. He's at the University of Texas MD Anderson Cancer Center, maybe with some news and some help for us. Dr. Harold Minkowitz is with us here on WCTC. Good morning, Doctor. It's Burt Baer, and how are you today?
Good morning. I'm fine, thanks. How are you today?
I'm okay. In New Jersey, Doctor, it is tough. We're dealing with a tremendous addiction problem that seems like it gets worse. Thousands of people are dying every year as a result of this addiction here to opioids. You've got some data to share with us this morning that could mean some hope and some help for some people here?
Correct. Well, I certainly do hope so. We're looking at, obviously, trying to decrease the gateway to opioid abuse. As you mentioned, all the opioid abusers out there, and people don't often think that the post-surgical setting is a really under-recognized gateway to opioid abuse. So a recent trial that was completed showed very exciting data that when combining HTX11 with over-the-counter oral pain medication, such as acetaminophen and ibuprofen, 90% of patients did not require opioids to manage their post-operative pain through 72 hours after surgery, or even need a discharge prescription for opioids. Additionally, 81% of the patients in the study were completely opioid-free through 28 days post-surgery.
It should be fair to say, Dr. Minkowitz, that anytime anyone goes through a surgical procedure of any type, it should be a relatively normal expectation that pain and discomfort may come along with this. Was that part of the reason of trying to make people as pain-free and comfortable as possible as to why opioids were prescribed so heavily in the first place?
Well, you're quite correct. Obviously, we like to have our patients as comfortable as they can following their surgery. And opioids have been prescribed almost routinely after surgery to keep our patients comfortable after surgery. So the reliance has typically been on opioids for want of a better therapy to allow us to have patients that are comfortable after surgery without having to use opioids, which is, as I said, that gateway to opioid abuse.
Yeah.
You're quite right when you said about the amount of opioids that are being given to patients after surgery. Recently, an FDA advisory committee showed that at discharge, patients received an average of 30 opioid pills after open hernia surgery. And they didn't really use all of those tablets. Mainly 9 or so were used after surgery.
Mm-hmm.
So if you think about the recent study, which showed that a dramatic reduction in opioids being required after surgery could translate to less opioid prescriptions, which could translate to less opioids being out there in the community. And I did the math, and for hernia repair alone, that would mean a reduction of almost 24 million opioid pills being given to the community, in the U.S. every year.
Any step in that direction, Doctor, is a good step in my opinion. I've known people that in a million years I would have never thought would have fallen prey to anything, let alone an addiction to opioids. And people have gone to rehab. People have died. We need something that's going to bring about some hope for all of us, I think. This HTX011 that you mentioned, is this something that's still in the clinical trial phase, or is this something that's being actively given to people?
So HTX11, you're quite correct, is not yet approved by the FDA. It's under review right now. The decision date is April 30th of this year. And what HTX11 really is, it's still investigational, as you said. It's a dual-acting local anesthetic agent, And it's given at the end of surgery without a needle, and the idea is to reduce pain for 72 hours after surgery. What's inside the HTX11 is two well-known and tested medications. The one is bupivacaine, which is a local anesthetic, which actually numbs the tissue, and the other is meloxicam, which is an anti-inflammatory drug, also given into the site of inflammation at the surgical site.
And this HDX11, when this is administered responsibly and correctively, the patient might not have to go down the opioid road at all if this works the way it's supposed to, right?
Correct. And
wow.
The data which this recent study showed was that they combined in the study, they gave HTX11 into the wound at the end of surgery, and simple pain relievers such as with acetaminophen and ibuprofen were given, and 90% of patients after surgery did not require any opioids at all to manage their postoperative pain through 72 hours after surgery. They didn't get a discharge prescription, and 81% remained completely opioid-free through 28 days after surgery.
This is fantastic. This is something that I think we need, Doctor, sooner than later. Is this something, is there a way that this gets fast-tracked or prioritized through the process, or are we still maybe a little ways away from seeing this a little more widespread in terms of how it's used?
Well, I think we mentioned that the approval date is April the 30th.
Okay.
But the FDA is doing all they can to combat this opioid crisis.
Sure.
And they gave a priority review to this drug to expedite the review process. And typically it's given to expedite the process for approval for drugs that are expected to have a particularly great impact on the treatment of a disease.
Oh. And
the FDA is doing all they can to try and help treat this opioid crisis, because I think they realize that we treating opioid addiction is critical, but we really need to start giving equal attention to preventing new patients from becoming addicted, because the fewer opioids that are needed and prescribed, this will be taken, and this will be out there in the general community to abuse.
This is remarkable. This will save so many lives if this comes to pass, Dr. Minkowitz. This problem just continues to get worse and worse every year. And if what you're saying is something that's going to get people to not even take opioids in the first place, think of all the addiction that's going to go away and people that would never fall prey to this. This is just remarkable news. I didn't know what to expect when you were going to come on the air with me today, but I'm literally overjoyed at hearing this news here today, just to know that there is some help down the road for people here in New Jersey and really around our country, that there's something that could actually be done in preventing this addiction, which is just destroying our country. It really is. It's destroying our state and our people. Where can someone go to get some more information and kind of stay with the updates of this, Dr. Minkowitz? How do they do that?
Well, the company that actually developed this product is a company called Heron Therapeutics. And their website is herontx.com. So it's HERONTX.com.
Oh, this is welcome news. I want to thank you, Dr. Minkowitz, for coming on with me today. I think we had actually canceled this interview, and then at the last minute I said, I got to get him back on because I got to hear what we're doing with this. So thank you for making yourself available, and this is tremendous news, and this is something we've been waiting to hear for a long time. So thank you for sharing this with us, and could we perhaps recap once we get to April and where this stands? Is there any chance that we could perhaps talk again?
This would be a pleasure.
All right. Dr. Minkowitz, thank you for the time today, and thank you for sharing this very exciting news with my audience today. I really appreciate it.
My pleasure.